Hello, so this presentation comes to you by Paul Deering and Joshua Warwinsky for the Health Promotion and Risk Reduction course at the University of Detroit Mercy. The health promotion topic we chose to look into was health strategies aimed at increasing physical activity in children. So this is an overview of our presentation. We'll first talk about the current statistics related to childhood obesity, which is the theme we're using to kind of frame our discussion here on the importance of physical activity promotion. So we'll review some of the statistics and then talk about what the research says are contributing factors to the problem and the best practices in terms of intervention targets and methods. So we'll then delve into the discussion about our two community-based interventions that support increasing physical activity in the childhood population. First, Josh is going to discuss the Kids Work It Out program, including an overview, outcomes of the program, its relationship to the Healthy People 2020 goals related to physical activity, and how it comes into play with the classroom concepts we discussed this semester. And he'll conclude by talking about the strengths and weaknesses of the program. So then I'll follow with the discussion about the second intervention, which is going to be the CATCH program. Specifically, I'll look into the early childhood program and discuss all the same aspects about it as Josh did about his intervention. And then finally, we'll compare and contrast the programs and offer a revised intervention related to some aspects of Josh's program. Of course, the references for all of the information and programs we're discussing are going to be cited at the end of the lecture as well. So we're going to start by just talking about childhood obesity in general. So it turns out that healthcare costs related to obesity have been estimated somewhere around $147 billion annually. That's according to the CDC. And it constitutes just a major concern in our healthcare system, and it's a big focus in the health promotions arena. So at an individual level, obesity often begins in childhood, and interventions that seek to promote childhood health are one avenue to address that bigger issue. So according to one of the literature reviews we looked at by Wofford in 2008, the prevalence of childhood obesity had been steadily increasing, although the CDC does mention that from 2010 to 2014, there was actually a significant decrease in the incidence of childhood obesity. But overall, current snapshot, according to the CDC, the prevalence among 2 to 19-year-old folks, children and adolescents, is about 18.5%. So that's about 13.7 million people. And you can see the breakdown here by age group, which shows this steady increase in prevalence with age. So 2 to 5-year-olds are at 13.5% prevalence, 6 to 11-year-olds 18.9%, and 11 to 19-year-olds are up to 20.6%. The other thing is that race and ethnicity data suggests that obesity affects different groups disproportionately. So non-Hispanic whites have a lower incidence than non-Hispanic blacks, who have a lower incidence than Hispanics. So there is some demographic data that shows that we have disproportionate incidences based on race and ethnicity. So there's also socioeconomic links as well. So the prevalence of childhood obesity will tend to decrease with increased levels of education of the head of the household, as well as with increased household income. So this is a picture just to show how obesity rates stack up regionally for younger children, like age 2 to 4. This was obtained from the CDC website. So 2014 data was the latest available there for that age group, but you can just see how Michigan compares to other regions nationally, and it seems to be about average, or at least somewhere in the middle, in terms of the rates compared to the rest of the country. And then when we move up to the adolescent age group, so kids that are in grades 9 through 12, you can then see that how obesity rates climb in terms of the prevalence in Michigan. And you can see that the prevalence in Michigan seems to be a little bit higher in the context of the rest of the country with this older age group. So it is clear that obesity presents this economic and health care burden to our society. And if we subscribe to the idea that the problem is rooted in childhood and want to initiate health promotion strategies to address it there, it's going to be important to understand what factors contribute to that. So according to another literature review that we found that was published in 2015, there's actually a number of factors and associations with childhood obesity that were identified. So among them, maternal pregnancy weight and gestational weight gain are predictive of childhood obesity. Then there's like DNA methylation in utero and like placental factors that are also involved. So those would constitute risk factors that might be addressed by initiatives aimed at expectant mothers, but they occur in utero and involve to some degree genetics, and certainly not factors that you could address to a developing fetus. But the authors also identified physical activity and sedentary behaviors, sleep patterns, whether or not the child is breastfed or formula fed apparently plays a role. The emotionality and temperament of young children are thought to be predictive, and then their patterns of behavior regulation as well. And then, of course, as you would expect, maternal feeding values and beliefs are going to play a critical role too. So you can imagine that health promotion initiatives could target a lot of these factors or others that aren't listed here, but for our purposes, we're just going to focus on that physical activity piece of it. But this slide is just meant to point out that obesity development in childhood isn't just a simple process, but it's complex and involves like multiple factors. So if we want to increase physical activity in childhood, what does the literature say about the methods and approaches that might be the most useful in achieving that goal? So according to a literature review we already mentioned, published in 2008, they ended up looking at a number of studies that evaluated the success of programs that were meant to address childhood obesity in general. So not necessarily just physical activity, but in general. And they found 4 key concepts that were frequently cited in their results. So the first one is that prevention is a better option than treating after the fact. The second thing they found was that when they used the programs that use strategies focused on building healthy habits related to nutrition and physical activity were better in terms of the long-term results than those that focused on limiting behaviors. And the third thing they found was that targeting children in their preschool years is the most opportune time to institute preventative strategies. And finally, they found that the other main focus was the importance of family modeling on children's behaviors. So family modeling related to nutrition and physical activity, as they purport, positive family modeling is absolutely vital to establishing lifelong healthy habits. So physical inactivity and obesity are positively correlative, but when we talk about physical activity in terms of obesity, there's actually a number of other reasons that you might want to care about it in children as well, not necessarily just those who are obese. So it supports, musculoskeletal development, gross motor skills. It's associated with better scholastic performance, healthy social engagement, and there's a whole host of other physical health benefits, including the prevention of diseases like certain cancers and diabetes. So there's a number of reasons. So currently the recommendation is that children and adolescents participate in at least 60 minutes of moderate to high intensity exercise daily, although the research suggests that benchmark isn't really met in most cases.
Thanks, Paul, for introducing and explaining the importance of instilling physical activity among children. I would like to begin our discussion on health promotion strategies to increase physical activity in children by examining the first of our 2 health promotion programs we've identified. The first community-based health promotion program is one that is close to home right here in Detroit. Kids Work It Out was founded by Danielle Carmanos as a nonprofit in 2005 and is a Wayne State University Center for Health and Community Impact program that provides quality programming to give children the tools to make healthy choices. The mission of Kids Work It Out is to promote optimum health in mind, body, and spirit through a comprehensive yoga-based approach that reduces anxiety, prevents childhood obesity, and increases self-esteem. Kids Work It Out reaches hundreds of children each year through a 10-week or 10-session yoga and nutrition program offered in elementary schools in the fall and winter. A 6-week summer program is also offered in schools and community centers. Kids Work It Out is a good program because it helps in meeting the needs of the community. Currently, schools in Michigan, grades K through 8, are not required to provide recess or physical education. Michigan ranks in the top quarter of the country for obese children and adults. Over 50% of Detroit's children are under 18 are living in poverty. Nearly 4 out of 5 children in Detroit public schools receive free or reduced priced meals at school. Kids Work It Out aims to prevent childhood obesity, provides the tools to make healthy choices, and encompasses the mind, body, and spirit. It also helps reduce anxiety and increase self-esteem. Fun, engaging, and educational activities are a part of this program, and it brings nutrition education and physical activity to children in a fun and inclusive environment. The goal of the program is to have children understand and appreciate yoga, healthy eating, and physical activity in an effort to improve mental and physical health. The holistic yoga-based approach teaches children to listen to their bodies and decide for themselves how to deal with stress. To date, Kids Work It Out has impacted the lives of 15,000 children In 2018, Kids Work It Out taught 800 children yoga practice, mindfulness, social and emotional learning, trauma coping, and nutrition education. This program visited 24 schools in Detroit, utilized 8 yoga educators to teach the Kids Work It Out program, and provided 5,000 nutritional handouts to children in the Kids Work It Out program. Next, we will look at the program overview of Kids Work It Out, which is a 6-step process. The first step is an introduction, upon which the weekly theme is introduced. Step 2 is breathing, where students identify the breath as a powerful presence in themselves and each other, and a themed breathing technique is introduced each week. The third step is yoga, where 20 minutes of physical activity based on 10 yoga poses called Sun Salute A. New poses are added each week to develop a flow or series of yoga poses connected by the breath. The fourth step of this program is relaxation, where students practice active stillness and identify positive intentions. The fifth step, nutrition, is where the food plate is used to explain the 5 food groups and identify healthful eating options. The sixth step, review, is where a review of the daily session and inspiration to apply the lesson in a meaningful way. Kids Work It Out is a yoga-based approach anchored by a weekly theme in a 1-hour formula. The same schedule is followed each week. This program is designed for optimum retention and participation from students. The cost of the program is $75 per participant, and the program relies heavily on community support, donations, and fundraisers for funding. In the 10-session class, each week features a theme to illustrate the nutrition content and yoga activity. The program also includes a workbook, which is a 64-page color workbook with graphic illustrations of yoga postures learned, 10 breathing techniques, a recipe book titled Building Healthy Meals on a Budget, and tips and advice on how to keep a healthy kitchen and lifestyle. The nutrition component of the course is reinforced with the use of the food plate, which can be found on choosemyplate.gov. The interventions provided by Kids Work It Out meets Healthy People 2020 goals and objectives. Physical activity is one topic for Healthy People 2020. The goal for this Healthy People 2020 initiative is to improve health, fitness, and the quality of life through daily physical activity. One of the physical activity objectives is to target younger children through physical activity in child care settings, behavioral interventions to reduce television viewing and computer usage, and recess and physical education in the nation's public and private elementary schools. The Kids Work It Out program empowers total wellness in children by providing nutrition education and physical activity in a fun and inclusive environment. Participation in this program improves the health, fitness, and quality of life of children by incorporating breathing, physical activity, relaxation, and nutrition education. The focus of this program is on mind, body, and spirit, which promotes physical and mental health in a meaningful way. The Kids Work It Out program increases the proportion of adolescents participating in physical activity in daily school physical education. The Kids Work It Out program has proven to be effective. The desired outcome set forth by the program is to promote optimum health in mind, body, and spirit through a comprehensive yoga-based approach, reducing anxiety, preventing childhood obesity, and increasing self-esteem, giving children the tools to make healthy choices. Kids Work It Out reaches hundreds of children each year through a 10-week yoga and nutrition program offered in elementary schools during the fall and winter, and a 6-week summer program in schools and community centers. A third-party study that was conducted on the Kids Work It Out program outlines the actual outcomes and the effect of the program on the community, which were self-esteem, stress, and nutrition. 93% of the students said yoga made them feel good. 72% of the students used the breathing techniques taught by Kids Work It Out to reduce stress, and 69% of the students changed their food choices and tried new healthy foods as a result of this program. Learning yoga helped kids feel better physically, which left them feeling calmer and more focused as well. The addition of nutrition education led to more mindful eating. And students also reported bullying behaviors decreased significantly over the 10-week period. This program can also be applied to concepts discussed throughout our health promotion course this semester. One of the concepts outlined by Edberg is the idea of the built environment. The ability to incorporate exercise into a common routine can vary depending on the built environment. The built environment can be described as a man-made surrounding that provides the setting for human activity, ranging from large-scale civic surroundings to personal places. Changes to the built environment can remove barriers and positively affect human behavior. Kids Work It Out creates an environment that is welcoming and safe. The setting is usually based in a school or community center, and the elimination of costs to the participants, the provision of time by program instructors, and access to an exercise and nutrition program removes some of the barriers that children in impoverished communities may face. Doing so encourages physical activity, nutrition education, and promotes the overall health and well-being of children. Kids Work It Out is also closely aligned with the social cognitive theory. The social cognitive theory is a social environmental theory, and the idea behind this theory is that changing a behavior is a function of a couple of characteristics. First one, individual or internal characteristics, is where self-efficacy is a key element in how people change behavior, moving beyond mechanistic conditioning and giving individuals the confidence that they can perform a certain behavior. Additional individual characteristics as part of the social cognitive theory include behavioral capability, expectations and expectancies, self-control, and emotional coping. Environmental or external factors include the social and physical environment, vicarious learning, and negative and positive reinforcements. Reciprocal determinism is another aspect of the social cognitive theory. This is a continuous interactive cycle upon which a person acts based on individual factors and their social and physical environments. Using a yoga-based approach, Kids Work It Out promotes the health of mind, body, and spirit to reduce anxiety, prevent obesity, and increase self-esteem. It provides kids with the tools to make healthy choices and promote healthy behaviors. Kids Work It Out also promotes self-efficacy, enhances behavioral capability, encourages positive emotional coping, and depicts positive outcomes as a result of making healthy behavior changes. These are individual characteristics. Instructors and participants promote vicarious learning and provide positive reinforcement. The program takes place in an optimal environment and enhances reciprocal determinism. The Kids Work It Out program, like all programs, has strengths and weaknesses. Strengths include being no cost to the participant, and the program offering a low-cost exercise strategy, which includes one yoga instructor, yoga mats, and workbooks. There's also ease of accessibility to participants as the program takes place in their schools. The Kids Work It Out program is also very inclusive, and participants in the program are doing this with their peers. The holistic approach to health and wellness is another strength of this program, in which the mind, body, and spirit are all encompassed. This is done through exercise, anxiety reduction, self-esteem enhancement, and nutrition education. There are also some things that could be improved upon this program. Some of the weaknesses include being a short-term intervention in which the program only lasts 10 weeks or 10 sessions, and the lack of aerobic exercise as part of the program. The physical activity guidelines for children and adolescents is 60 minutes or more of moderate to vigorous activity daily, outlined by the U.S. Department of Health and Human Services. To improve on this program, we feel that a long-term intervention, one that is greater than 10 weeks or sessions, could be beneficial. Additional forms of exercise incorporated into the program, such as aerobic activity, would also improve the program. Different types of aerobic activity could include running, hopping, skipping, jumping rope, working with resistance bands, basketball, or hopscotch, to name a few. And finally, adaptability of activities for those who are physically or otherwise health impaired would be another beneficial improvement for this program. The Kids Work It Out program is culturally appropriate, it's inclusive of all races and ethnicities, is gender appropriate, including boys and girls, and is also developmentally appropriate, and is tailored to elementary aged children. Next, Paul will outline our second community-based health promotion intervention, the CATCH program.
All right, so the second program we're going to talk about is called the CATCH program, and that stands for Coordinated Approach to Child Health. It was developed in the late 80s by a couple academic institutions that were trying to promote childhood health and address childhood obesity. So the main foci of the programs are both nutrition and physical activity, but they do attempt to involve family and community. The website claims that there's over like 120 studies validating the success of their programs, and they are proud to purport themselves as like an evidence-based option for schools. But from the information on their website, you kind of learn that the program's sort of like a resource center. So schools and school systems and like daycare centers and things like that can go to their online site and purchase resource packages to like integrate into their existing programs, or they can actually purchase entirely comprehensive programs that come complete with like lesson plans, physical materials, and even training resources for the teachers and other people who will be implementing the program to help make sure that it's a successful implementation. So the major programs offered are tailored by age group. So they include like preschool to kindergarten, kindergarten to fifth grade, sixth grade to eighth grade, as well as after school programs. And those programs are now being continually researched and revised at the University of Texas School of Public Health. So it's not just a program that was developed and implemented, but also one that continues to grow and adapt, to the modern needs of our kids. So CATCH is a big platform with several programs. And for this presentation, given that the research we mentioned earlier is telling us that it's important to focus on the preschool age group, we just wanted to look at the CATCH early childhood package. So it's tailored to kids in that 3 to 5 year old age range. Of course, I couldn't evaluate the program's lessons and materials directly because it's something that you have to purchase, but I did find a pilot study for the program that was published in 2011 that gives like a sufficient amount of detail about the specifics of the program so that you can actually evaluate it. So here are some images that were taken from the CATCH early childhood brochure on their website. You can see it includes pictures of some of the resources that are included in the program. So you see there's like puppets, there's gardening supplies for some of the lessons, there's stickers and coloring activities. The one in the upper left-hand corner shows a box with cards in it, and this is the physical activity piece of the program, where kids basically select an activity card and perform that action in sort of a structured daily allotted time for physical activity, and it comes with a music CD. So the pilot study I found and mentioned earlier kind of explains how the program works more specifically. So it was published in 2011 and tested the program at 2 Head Start institutions that had predominantly African American Hispanic children from low-income families. So it's not necessarily the target population of the program, but it happens to be the population that they initially tested it on. And the authors mentioned that all of the resources were available in English and Spanish, which sort of harkens back to our discussion about cultural competence and exemplifies one of the ways in which a program can make sure that it's inclusive and adaptable to more than one kind of population. So the other piece of it is that there were parental focus groups included in the study to examine a number of things like perceptions about their children's health status and effectiveness of various parts of the program. And in those groups, they made sure that moderators were present who spoke both English and Spanish. So this is important because if you have a program that wants to develop in a way that's successfully inclusive of the Hispanic population, it would of course be important for it to make sure that they get the feedback from those parents and receive it and interpret it appropriately. So I can't really evaluate the cultural applicability of the materials of the program because without actually seeing the materials, but the efforts to make sure that they are available in multiple languages shows that developers were at least thinking about crossing those cultural boundaries. So there are essentially three parts to the Catch Early Childhood Program. The first is a classroom curriculum component. It consists of 9 lessons. The study gives a little synopsis of each lesson, and it turns out they're all related to nutrition. So the classroom portion is all nutrition. And there are some activities involved in it as well. So it's not just a lecture that kids get, but they get to do things like gardening activities and read stories and see puppet shows and that sort of thing. So the second piece of the program is the physical activity portion, which is the one we wanted to focus on. So this was implemented by carving out like a 20 to 30 minute segment of time each day for what they call a go activity. And the study explained that there were a couple phases associated with that. So it starts with like a classroom management portion where the expectations for the kids' behavior are outlined. Then there's a warm-up section, then a go activity section where they actually like select the activity card and everyone performs it or whatever. And then there is a cool down phase and a stretching phase. So the activities are what the developers call moderate to vigorous physical activity. I didn't come across an actual list that specifically said what all the different activities are, but I know there's over 120 cards. So there's a lot of variety associated with it. And the study did say that the activities were adaptable to physically disabled. So that's another way that they're being inclusive to different populations, although it didn't specifically say what they were. So the final part of the program is the parental education piece. So this basically involves sending the kids home with tip sheets that give parents that they give their parents. There's like 9 of them, and the study mentioned the general topics of them. So I just looked at them and said 6 are related to nutrition, 1 is related to physical activity, 1 is actually about limiting screen time, and then there's 1 that provides parents with additional resources that they might need after the program has been completed. So this was a pilot study, and the researchers did try to measure some outcomes quantitatively and qualitatively that I'll get to in a little bit, although there were a lot of issues that skewed results that actually kind of make them not even worth mentioning. But we'll talk about them in just a minute. So Josh already talked about some of the Healthy People 2020 goals related to physical activity in general. The goals directly related to physical activity don't really have a particular focus on the 3 to 5 year old age group, though, that's targeted by this program, which is interesting given that the research seems to support the idea of targeting that population. At least that literature review I mentioned earlier found that to be the case. But nevertheless, you might argue that it does support objectives geared towards the older age groups indirectly by educating and instilling these good habits related to physical activity at an earlier age. So I included those objectives, the PA3 and PA5, as being relevant here. The other thing is that one of the tip sheets that are sent home to the parents is focused on reducing screen time. And there's actually a Healthy People 2020 objective for that in the physical activity arena. Of course, the idea is that by limiting the computer, television time and other screen time, that kids would be more able to participate in like less sedentary activities like going outside to play or whatever. Of course, there are other objectives supported that are related to the nutrition side of the program, but I didn't mention that here since we're focusing on physical activity. But just keeping in mind that the emphasis on physical activity is really only half of the focus of this program. All right, so the pilot study for this program actually explicitly emphasized that it was designed based on the social cognitive theory. So I think it's appropriate because when I think of individual-based behavioral theories that we had initially talked about, like the help belief model and the theory of planned behavior and that sort of thing, they don't really seem appropriate for this age group because those theories kind of imply that the individual rationally thinks about these benefits and risks related to behavior, and then they think about like social consequences of adopting a behavior and kind of end up making this conscious rational decision about whether or not they're going to adopt or rid themselves of health risk behavior. So I don't think this really works for small children because they don't really have the cognitive reasoning skills to make those kinds of decisions. They're actually dependent on others like their caregivers and teachers to make decisions for them, and they don't really have the resources to make changes on their own, even if they could make those decisions. And by that I mean if a preschooler even had the mental capacity to be like, oh, I'm just eating too many fried foods, I need to change my dietary habits, which is almost comical to think about that they would actually think that way. But even if they did, they couldn't go to a grocery store and then dictate to their parents what kind of food they would buy and come up with meal plans and that sort of thing. So that leaves us with the social cognitive theory that's really all about operant conditioning. So these kids are learning based on positive and negative reinforcements of their own behavior as well as from the behavior of others. So the Edberg chapter talks about this, about how it started out as with like more behaviorist roots, but kind of evolved into more focused on the interaction of people in their environment. And so the theory includes these individual and environmental characteristics that we listed here, and the process of reciprocal determination reflects those interactions between the individual and environmental characteristics. And again, what I like most about that is when it comes to children is that there isn't necessarily any decision making going on. It's a process that's that doesn't exceed their mental capabilities or developmental reality. They just interact with their environment, and they're faced with consequences and rewards on their behaviors, and that's what drives their behaviors and them to change their behaviors. So the pilot study actually specifies what constructs of the social cognitive theory are emphasized in each component of the program. So that made it very easy to figure out. So in the classroom curriculum, and I know it's hard to see on the slide, but in the classroom curriculum, you have knowledge, skills, self-efficacy, environment, self-control of performance, and reinforcement are the constructs. And with the physical activity component, it's based off of the same constructs with the exception of addition of observational learning. And in the parent education component of the program, you have knowledge, skills, self-efficacy, outcome expectation, environment, and reinforcement. So of course it's hard for me to actually evaluate how strongly each of these components reflect those constructs because I can't actually see the actual materials of the program, but those are the concepts that the program aims to address, in their components of their program. So if we look at the qualitative and quantitative outcomes of the study, it kind of reveals the strength that I alluded to earlier. It kind of reveals the strengths and the weaknesses and the areas of improvement that we need. So strengths include that the program, it really attempts to be holistic in its approach, and that it addresses childhood health by including not just physical activity or nutrition, but both, as well as some other topics. And it also attempts to involve the family by sending home these little tip sheets with the children. And it also addresses the population characteristics by including materials that are, multilingual and having physical activities that are appropriate for disabled children. So it was pointed out earlier when I was talking about best practices when it comes to addressing childhood obesity would include targeting this age group, which it does, and involving family in the intervention, which it also does. So it kind of checks a lot of those boxes. It also uses social cognitive theory as its underlying theoretical framework, which I mentioned is probably what I think is the most appropriate for this age group. And then it also included training components for like the teachers and whoever would be implementing the program, which is an important piece rather than just throwing a bunch of resources at them and having them try to figure it all out and implement it. The developers took the time to make sure that they would be supported in a way that they would be able to implement these programs effectively in their institutions. So according to the results of the study, the kids were really receptive to the physical activities included in the program, and as well as the hands-on classroom curriculum. Although some teachers did say that the stories were too long to hold the children's attention, and that the music on the CD that accompanies that activity box was too slow. So those are really all the strengths and also some of the areas of improvement over there. So when it comes to the weaknesses, the first thing I wanted to mention that I found absolutely fascinating is that the demographic data for the children involved in the study showed that 39.4% of them were classified as overweight or obese. So almost 4 out of 10 were overweight or obese. So before the intervention, they did this parental meeting, and they asked the parents what they thought about their child's health and weight status, and only 1.5% perceived that their children were overweight or obese, despite the fact that 39.4% were. So that was crazy to me. It really emphasizes the need for a strong family component in these programs. So when dealing with children who rely on their caregivers to make healthy choices for them, how is that going to happen when the vast majority of them don't even see that there's a problem to begin with? So the researchers in this study kind of merely mentioned that, or they talked about it a little bit, but it feels like it's a much bigger point to me than what they gave it. So I thought it was great that they sent home these tip sheets to the parents, but the family component of the program really should be stronger. I don't think 9 tip sheets are really adequate. And of course, only one of them addressed physical activity. And I don't feel like the effectiveness of those were really adequately measured, because they simply brought the parents back and said, were these helpful or not? And they were like, yeah, sure. I enjoyed the recipe ideas and that sort of thing. So, and we talked about that only one of them was addressing physical activity and the rest were focused on nutrition. The other weakness that's suggested by the study was that the teachers didn't really end up incorporating the activity box in their daily lessons as was intended. So it was intended that there was a 20 to 30 minute daily time devoted to this activities, and it turns out that they did not do that. Although they did say that when they did, that the children were very receptive to them. But it could be one of the reasons that the percentage of moderate to vigorous physical activity levels of the children measured before and after the intervention actually went down rather than up. And the other issues related to that were that the pilot study was implemented just before the winter months. So when the children couldn't go outside as much, and the institutions where the intervention was piloted didn't have any indoor gym or activity centers to compensate for that. And as a result, the number of post-intervention observations of physical activity for the statistics actually was like half of the pre-intervention data points. So there were a lot of issues that make it very unclear as to whether or not the benefit of the physical activity piece was actually successful. So other opportunities for improvement suggested in the qualitative data that they received from the parents and the teachers and like focus groups included speeding up the music on the CD that I mentioned, shortening the time of some of the classroom activities that were too long to hold the kids' attention. And other things I thought of were that the classroom portion was entirely focused on nutrition. So the program seems to foster physical activity, but it's lacking in physical education. So I thought that the curriculum might be revised to include some physical education components. It's also clear that more research needs to be done to really evaluate whether or not that physical activity component was effective in increasing the activity levels of children, since there were so many issues with the research there.
In comparing the two previously discussed programs, it is clear that there are a variety of similarities and differences among each program. Both of the aforementioned programs are rooted in promoting physical activity and healthy eating behaviors. They also have affiliations with academic institutions. Kids Work It Out has partnered with the Wayne State University Center for Health and Community Impact, and the CATCH program is affiliated with the University of Texas School of Public Health. Involvement with academic institutions provides the means and resources to develop, implement, and adapt programs to meet the needs of the target recipient. Both programs also provide children with the tools to make healthy choices and are culturally, gender, and developmentally appropriate for the children participating in the programs. The social cognitive theory is also applicable to both programs, and based on the social cognitive theory, children learned based on positive and negative reinforcements of their own behavior as well as the behavior of others. They interact with their environment, and the consequences and rewards of their actions drive their behaviors. The programs are also different in a multitude of ways. Kids Work It Out takes a holistic approach encompassing mind, body, and spirit, and is yoga-based. Kids Work It Out helps in reducing anxiety and increasing self-esteem. The CATCH program incorporates additional healthy behavior teaching, including education on e-cigarettes and the risks of sun exposure. Kids Work It Out takes place in Detroit schools. To date, the program has impacted the lives of 15,000 children. In 2018, Kids Work It Out taught 800 children yoga practice, mindfulness, social and emotional learning, trauma coping, and nutrition education, visited 24 schools in Detroit, utilized 8 yoga educators to teach the Kids Work It Out program, and provided 5,000 nutritional handouts to children in the Kids Work It Out program. With the CATCH program, 10,000 schools have adopted the program across the U.S., in Canada, and Ecuador. More than half of the schools in Texas utilize this program. Kids Work It Out is available at no cost to the schools involved. Funding is solely through donations, fundraisers, and community events. CATCH is available for schools to purchase resources or programs. Limited funding may limit some schools from being able to purchase the program in order to implement it. The type of activity incorporated in each program is also different. Kids Work It Out involves mild exercise, stretching, and breathing. CATCH fosters moderate to vigorous physical activity through a variety of exercise activities. In an effort to reduce some of the previously mentioned barriers to the Kids Work It Out program, a revised practice model could be implemented to maximize the strengths and minimize the weaknesses of this program in order to foster continued success within the community. The revised practice model implements the strengths of the Kids Work It Out program and focuses on the improvement of the identified weaknesses. The revised program should maintain the mission of the Kids Work It Out program, which is to promote health in mind, body, and spirit through a comprehensive yoga-based approach that reduces anxiety, prevents childhood obesity, and increases self-esteem. The addition of a yoga and physical activity-based approach would be part of the revised model. In addition to implement an additional exercise component, we would also like to lengthen the program to at least 15 weeks or sessions, allowing for continued structure and an organized routine with the hope that the healthy behaviors will continue to be reinforced and then maintained even after the conclusion of the program. Instead of 6 steps, a 7-step process would be implemented. The 7 steps would include introduction, the exercise or physical activity component, breathing, yoga, relaxation, nutrition, and review, and the daily program would last for 80 minutes, which would allow for the addition of a 20-minute physical activity component. The addition of this physical activity, which would be aerobic in nature, would better align with the physical activity guidelines for children outlined by the U.S. Department of Health and Human Services. That is 60 minutes or more of moderate to vigorous activity daily. Examples of aerobic activity that would be appropriate could include running, hopping, skipping, jumping rope, working with resistance bands, basketball, or hopscotch, to name a few. Since the program takes place in schools or community centers, utilizing a gymnasium or a similar open space would allow for this activity to take place. This program would still be offered at no cost to the participant, relying heavily on fundraising efforts, donations, and other community support. This is important because the target population is one that is considered to be at risk: children living in an impoverished community. The holistic approach would still remain a large focus of this program because it offers children the opportunity to improve the overall health and wellness, including mind, body, and spirit, not just physical health. This program would help in the formation of well-rounded individuals. Overall, we feel that with the addition of a physical activity component, which would be moderate to vigorous in nature, the already successful outcomes from this program could become even greater, with the greatest impact being related to fighting childhood obesity.
So we appreciate your attention to our presentation. We hope you enjoyed it and found it informative. Following is a list of our references that we used in gathering the information for this presentation. Have a great day.